I saw the death of my father and older brother when I was a child. They had a tough illness, but it wasn't untreatable. We just couldn't afford their medical expenses. My mother used to work full-time, but she just couldn't cover their treatment costs. Actually, I lost my family members to poverty and a lack of access to healthcare. Welcome to the Broken Ladder Project, where we dive deeply into different aspects of inequality based on the original book. Before getting started, don't forget to like this video and subscribe to Human channel for more content on social and economic issues. In this episode, we're moving to chapter 5, when inequality enters our bodies and affects our health. We all know that poverty is bad for our health, mostly due to a lack of access to basic medical facilities, good hygiene, and healthy food. The lower our position on the status ladder, the shorter our lifespan becomes. On the other hand, each step towards wealth leads to longer life expectancy. Interestingly, a study found that in affluent neighborhoods, we have recorded 15 deaths per 10,000 people. This number rises to 90 deaths per 10,000 when it comes to impoverished areas. Now let's take a look at the situation in different countries and compare them. The income of Indians is only slightly higher than Mozambicans, but this has had a significant impact on life expectancy in India. The strange point is that when a country reaches a moderate level of development, like Chile or Costa Rica, the effect of income on life expectancy stops. This means the wealth of that country no longer has an effect on citizens' life expectancy. For example, in this case, United States has no advantage compared to countries like Bahrain or even Cuba. We understand that the relationship between health and money alone doesn't reflect poverty. So, what's in play here? Say hello to inequality. A study on the status of employees in a particular organization revealed that people's perceptions of their own position on the status ladder is a more significant factor that determines their health situation. The subject's ideas of their position on the status ladder is more important than their actual job title, because it determines their anxiety levels and also their sense of satisfaction or dissatisfaction. Now we know that in societies with greater inequality, health and life expectancy are lower. It now becomes logical why a country with greater levels of wealth might still with this challenge as an issue. The link between inequality and healthcare is easier to see when we look at the statistics for heart diseases, cancer, different kinds of diabetes, and obesity. Macroeconomic policies and social relationships manifest themselves in our bodies, and we experience them. High inequality is also correlated with greater dangers of smoking, overeating, and committing crimes and violence. There are also clear connections between the temptation for shorter-term pleasures rather than thinking about our long-term health. Remember the live fast, die young theory we talked about? Again, it's about that. The feeling of being left behind leads to dangerous and unhealthy decisions. This explains 1/3 of the relationship between health and inequality. The other 2/3 is related to the physiological response of our body to the inequality. I mean, the stress response. The stress we get from the feeling of inequality activates our body's survival mechanisms. For example, it stops digestion and suspends non-essential activities. High stress can make us more likely to get obesity and diabetes because our body stops using insulin properly and doesn't absorb glucose well. It also stops growth. That's why children in impoverished areas might not grow as much. The body might even attack its own immune system, which leads to autoimmune diseases. Our immune system can weaken to the point of causing hypersensitivity and allergies. Stress is how our body deals with immediate problems, but it comes with a higher price later on. Things like financial problems or feeling low on the status ladder trigger these stressful responses. People with lower incomes or those who are at the bottom of the status ladder often feel more stressed, and they have more stress hormones in their bodies like adrenaline or cortisol. They also have more inflammation throughout their bodies. If you feel like you don't have enough, your body cells start demanding immediate needs and putting off worries for future. Inequality makes this worse by making people feel less secure. In the end, you have to pay for this short-term crisis management with your body and your health. It's the future you had put off paying attention to. So that's it for this week. Stay tuned for our next episode where we'll talk about the relationship between inequality and religion. I bet that's one of the controversial topics we'll talk about. If you enjoyed this video, don't forget to like it and subscribe to Human Egg channel for more. I'll see you soon next week. Bye for now.